Right. So what I'd like to do is share with you a recent analysis we did for the Colorado Medicaid population to see what would be the impact of treatment if we remove restrictions around fibrosis. And so for the purpose of the analysis, it's the same analysis we've run in all 70 countries with different ministries of health, with different CDC organizations. We assumed that there were 9,900 hepatitis C positive diagnosed individuals in the Colorado Medicaid. So that was a starting point. And we also assumed that 175 of them were being treated today or F3 and higher. Now, under this scenario, if you look at the disease progression modeling that we've actually published in Journal of Hepatitis, in Journal of Hepatology, what we see is that the number of liver-related deaths in hepatocellular carcinoma is actually going to increase by 250% over the next 15 years. So the level of treatment, this 175 at F3 and higher, is not sufficient to manage the disease. We're going to see a continued increase in disease progression among the individuals infected with hepatitis C in the Medicaid program. And we also will see a 300% increase in decompensated cirrhosis. I believe everybody here is familiar with decompensated cirrhosis versus compensated. Then what we started doing is looking at different scenarios of what it would take if we increase treatment and remove restrictions around fibrosis. So we looked at a couple of scenarios. What if we slowly increase treatment to 630 patients annually by 2020? And the second scenario, which we did the same, but then it continued to expand it to 1,000 patients by 2024. And we slowly removed restrictions for patients, actually. And so expanded to everyone. And what we saw was if you expand treatment to 630 annually, then you actually do see a flattening of liver-related deaths, HCC, and decompensated. So that's enough to actually manage disease burden. And when we increased to 1,000, we actually saw a fairly strong reduction in the number of liver-related deaths. In fact, 70% reduction by 2030. So that's going to be fairly effective. So the big question for everyone is what is that going to cost? And so we did an economic impact analysis, incorporating the cost of treatment, but also the cost of the healthcare costs. For the healthcare costs, we used a study that was published by Professor McAdam Marks from University of Utah, where she looked at the annual cost of cirrhosis, decompensated cirrhosis, HCC, based on 34,000 patients diagnosed with HCV in managed care organization. It's a well-published, it's a well-referenced study. And when we ran the analyses, as you would expect, as you increase treatment to 630, as you increase to 1,000, you would see a corresponding increase in healthcare costs, in the total cost, actually. So the cost of treatment will go up. But what was interesting is about 2/3 of that cost actually will be offset by decrease in healthcare costs. So we would have fewer hepatitis or carcinoma cases and decompensated. And we did not assume liver transplants, significant number of liver transplants in this population. Now we also take into account indirect costs, because remember now, these people also have a longer life expectancy. And so we took into account life expectancy increase as well as productivity. But for this population, when we monetized it, we used a $20,000 to $25,000 per person. The average U.S. gross national contribution to the GDP is about $54,000. Because Medicaid is a special population, we actually used a low rate. And in fact, that offset the total cost by another $17 million. So what was amazing was if you treat this population, expand treatment, and you can get a $35,000 per treatment, it's actually, instead of Colorado, we spend less on Medicaid after 2027. So it's actually cost saving. And if it's 40,000, it will become cost saving by 2029. Okay, so we're going to save a lot of money later on, but there will be an upfront cost. So how about that? So what are we going to do to offset that? Now, what we also looked at is the fact that about 6,000 of the 9,900 people in the Colorado Medicaid are part of the Medicaid expansion program, and that cost could be actually offset by federal.
Your time's up.
If we do that, essentially all the costs will be offset, and we see a positive ROI in year one, which is 2017. Thank you so much.